Well, my friends, this gentleman is about 63 years. The main complaint is pain in the right side of the back, right chest, in the right chest and right back. For which he had treated with the different medical colleges, modern hospitals and nursing homes in the department of oncology, and a case of right lung SOL space occupying lesion. So a big lesion in the right lung. The size is about 2.1 into 2.0 centimeter SOL. So no doubt it is a case of malignant growth. And of course the bad effects of tobacco. সিগারেট বিড়ি আগে খুব খেতেন, বিড়ি খেতেন দিনে কটি 10-15টা খেতেন। এছাড়াও উনি বিড়ির কাজ করতেন, বিড়ি বাঁধার কাজ করতেন। সো দি পয়জনাস এফেক্ট in case of tobacco bad effects come in 3 ways, 3 ভাবে আসে। Number 1, smoking, taking tobacco. Number 2, in the passive way, বাড়ি থেকেও খাচ্ছে, বাসের মধ্যে খাচ্ছে, ট্রেনে খাচ্ছে, রাস্তায় খাচ্ছে, হু করে আরাম করে ধোঁয়া বের করছে। পাশের লোকটি যত গ্রহণ করছে, যে লোকটি খাচ্ছিল তার থেকেও এনার বেশি ক্ষতি, কারণ ডাইরেক্ট সবটা ইনহেল করছে, টেনে নিচ্ছে ভিতরে। ও ছেড়ে দিল, ইনি গ্রহণ করলেন। ক্ষতিটা কার বেশি? যিনি গ্রহণ করছেন পুরোটাই। সো এইভাবে অনেক মহিলাদের আমি দেখেছি, আই হ্যাভ সিন ইন মেনি ফিমেল ক্যান্ডিডেটস হ্যাজ বিন সাফারিং ফ্রম carcinoma of the lungs due to passive smoking. They are the victim of passive smoker. 3 number, those who are the workers in the tobacco factory, মাস্ক ছাড়া, বিশেষ করে উইদাউট মাস্ক, গ্রামের দিকের মানুষ যারা বিড়ি বাঁধে তারা তো কেউ মাস্ক ব্যবহার করে না। আমি অনেককে বলেছি তাই অন্তত গামছাটা বেঁধে নেবে। মাস্ক তো আপনি ব্যবহার করতেন না তখনকার দিনে আগে। তো ইনহেল অফ ফাইন টোবাকো ডাস্ট, ডে অ্যান্ড নাইট, রাত দিন কাজ করে চলেছে, টোবাকো ডাক্ট ভিতরে ঢুকে যেতে পারে, অ্যান্ড দ্যাট মে ইনফিল্ট্রেট দ্য প্যারেনকাইমা of the lungs. So this is a malignant condition, and this patient is, to me, is a case of metastasis. এখন ব্যথা কোথায় কোথায় হচ্ছে? The pain metastasis in the different parts in the posterior abdominal wall, and severe agonizing pain for which he is in distress, and for which he is used to take numbers of allopathic painkillers in every day, but without any relief, and the life is in great agony and distress. So he has come, he is brought to me for the further treatment. So this is a case of malignancy of the lungs. The malignancy of the lungs begins from the inner cells of the lungs. It is the leading cause of worldwide death. It is common in men than in women, and is the cause of nearly half of the death of the CA of different parts. In many cases, it is primarily asymptomatic. When the tumor occurs in a large bronchus, early symptoms arise, but tumor originating from a peripheral small bronchus can grow symptoms slowly resulting in delayed diagnosis to the physician. The non-metastatic symptoms are found only in advanced stage, and the symptoms are cough, hemoptysis, and shortness of breath. The cough is the most commonest symptom and is often dry except when there is secondary infection in the lungs. This sputum may be purulent or iron dust colored. Hemoptysis occurs eventually in most patients, especially in central bronchial tumors. Sputum content is blood stained or contains small blobs of blood. Coughing of fresh red blood is less common in malignancy of the lungs, but which is more common in the bronchiectasis. Shortness of the breath is due to the bronchial obstruction when there is secondary infection. It is usually associated with productive cough. Chest pain is caused by the pleurisy when the growth is invading the ribs with the intercostal nerves. Thus the pain increases with every breathing, and via the intercostal nerves, the pain may radiate to the back, which is presently found in our subject. There is wheezing breath sounds due to bronchial obstructions. So there may be chance of metastasis in the brain cells, in the liver, and also to the esophagus and other parts of the back or abdomen related. The main symptoms are loss of weight and loss of appetite, headache and malaise, etc. The constitutional symptoms. Clubbing of the fingers is another symptom, is often present and may be helpful in acute diagnosis. The finger clubbing shows overgrowth of the soft tissue of the terminal phalanx, leading to increased nail curvature and nail bed fluctuation. And this is often seen as found in these cases, my friends. So clubbing of the finger is a very, very important symptom. The nail margins become swelled and looks like club. The toxic secretion from the carcinomatous cells may lead to mental confusion, peripheral neuritis, and even ataxia, that is steadiness of the movement. So, etiology is very, very important. As I have already told, cigarette or bidi smoking is the most important cause of this disease. The tar content of the cigarettes or bidi is the main poison which causes growth of the bronchus, and in 85% cases of lung CA are due to smoking. So the people who smoke are the greatest risk of lung CA, and so non-smokers are the less sufferer of developing lung CA, but lung CA can also happen who have never smoked, as I have already told. In modern treatment, surgical and radiation therapy is effective in non-metastatic stage, but in metastatic space, it is very difficult to regain the normal health of the patient, my friends. So, this patient already consulted a few homeopathic physicians, and I have seen the papers. One is I have repeatedly told, one physician is a quack who claimed himself a cancer specialist, etc., a gyno specialist, cancer specialist, etc. He doesn't know even the term, the spelling of gyno. There is no term, no spelling of gyno. It is the subject known as gynecology, and the spelling will be Gynae. Though the writing clearly indicates he is a quack and cheater, and public every day consulting with the cheater who has prescribed in this case numbers of polypharmacy, I mean the masla muri, and without, no doubt, without any result. He has prescribed Baritacarb 30, Arnica montana 200, Cratigas mother, Macphos 30, Robinia mother, Brata mother, Natramphos 6, Justicia mother. However, repeatedly I am shouting, बार बार चिंता लगी अबे এই সমস্ত বাস্টার্ডগুলির জন্যে এখনও কোনো আইন হচ্ছে না। হোমিওপ্যাথিক কাউন্সিল কোনো কিছু প্রচেষ্টা নেই তাদের। হোমিওপ্যাথিক মেডিকেল অ্যাসোসিয়েশন অফ ইন্ডিয়া নামে একটি বড় পার্টি যারা আছে তাদের কোনো মাথা ব্যথা নেই। এই সমস্ত চিটারগুলো, এই সমস্ত বাস্টার্ডগুলি হোমিওপ্যাথিক নামে মানুষের ক্ষতি করে চলেছে। এরকম মশলা মুড়ি দিয়ে দিয়ে দিনের পর দিন নিজেদেরকে পরিচয় দিচ্ছে ক্যান্সার স্পেশালিস্ট, গাইনো স্পেশালিস্ট, ইভেন গাইনোকোলজি বানান জানে না। এই চিটারের সম্বন্ধে আমি অনেকবারই বলেছি, কিন্তু বললে কী হবে, দশমিন দেশে জদার। হি হ্যাজ কনসাল্টেড অ্যানাদার হোমিওপ্যাথিক ফিজিশিয়ান হু ইজ very familiar to me, Dr. Sunirmal Sarkar, and he has prescribed the medicines I have seen: Oleum anomaly, Cradigas 30, Lobelia inflata, Brimstone 30, Clubmoss 30, Ruta 30, Cabecum 30, Bellis perennis 30, Nicotinum 30, etc. So the patient has come to me, and I do like to prescribe in this metastatic stage. My medicine is Lycopodium clavatum, because the right side is affected, the right-sided lung is affected, metastasis is also naturally right-sided, and there is desire for warm food, etc., dictatorial attitude. And if I go through the modern repertory, the lung CA, Lycopodium, is also plays an important role. For pain relieving, there is also Lycopodium. So let's prescribe Lycopodium. How much pain we may control by this medicine to this patient. Let's prescribe Lycopodium in 50 millisieverts scale of potency, my friend, and let's see the result.